Hi, this is Brock Lomax,
And this is Jordan Wood.
and we're the co-chairs for Operation Respiration for APhA-ASP, and these are some talking points you should go over when presenting any respiration facts at health fairs.
First, we're going to talk about inhaler types. There are many different inhalers, including metered dose inhalers.
Metered dose inhalers are your typical rescue inhaler. A lot of you have probably seen a ProAir or a Respimat, something like that. These have their own propellant. They don't require the user to have breath control, and they have a dose counter on the side.
Next, we have our dry powder inhalers.
Dry powder inhalers require the user to have the ability to breathe in forcefully enough to deliver the medication to the lungs.
And then your nebulizers.
Nebulizers are usually rented or purchased. They use little ampules of medication, and it's a machine that must be plugged in, and it offers a longer and more complete breathing treatment.
These different inhalers are very patient-specific. The devices are prescribed based on the patient's age, level of coordination, preference, and cost. Pharmacists are basically inhaler experts and can optimize patient outcomes by teaching proper inhaler techniques to you.
Like we said in the previous slide, a lot of these are selected based on a patient's age and ability. So this is a chart you should become familiar with to know what patient is eligible for what type of inhaler. You can see at the top a metered dose inhaler. If the patient is 5 or older, they can use it without a spacer, but if they're younger than that or have poor breath-hand coordination, they really should get a spacer to deposit the medication in their lungs properly. You can go down the list and familiarize yourself with the rest of these as well.
It is important for people with pre-existing conditions such as asthma and COPD to be aware of how air quality can affect them. Understanding this chart can also be helpful to the patients you talk to on teaching them about this and in helping explain why this is so important.
Smoking cessation. There are many over-the-counter and prescription options available to aid those who want to quit smoking. A common problem that people trying to quit smoking find is that they're not actually getting enough nicotine to replace their cravings and stop their cravings. So one area where pharmacists are really important is asking questions, seeing how much they're smoking, and then providing accurate nicotine replacement options for the patient. Using nicotine replacement therapy combined with cognitive or behavioral strategies has been proven to work better than quitting cold turkey. Many prescription options like Wellbutrin or Zyban and also Chantix, varenicline, are covered by insurance at least the first time you try, sometimes multiple times.
Another big problem that you're going to face with Operation Respiration is vaping and e-cigarettes. The long-term effects of vaping are not yet known since this is a newer thing. We're just starting to now see the effects that it's having on patients, and it's becoming more of a problem, so it's something that you should be aware of. Nicotine is an addictive substance, and one vaping pod can contain as much as 40 cigarettes, which is 2 packs of e-cigarette vapor contains diacetyl, heavy metals, and nicotine.
When speaking with people at health fairs, it's important to recommend the proper vaccinations. Something you're always going to want to suggest is an annual influenza vaccine, especially if someone's immunocompromised, if they have COPD or asthma or some other underlying comorbidity. It's important to choose or suggest the right vaccine for them. If they're older than 65, you want to give them or suggest getting a high dose or something with an adjuvant to produce a higher immune response. You never want to suggest a live vaccine like the flu mist. If someone's a smoker or they have asthma or COPD or they're immunocompromised, like they've had their spleen removed and have a little more trouble fighting infection, maybe they were HIV positive, you want to make sure that you recommend and counsel on both Pneumovax and Prevnar. The dosing algorithms have changed recently, so it's important to familiarize yourself with those. Those can be found on the CDC's website if you really care. Most importantly is the annual influenza vaccine. This concludes the training video.
Thank you for listening, and we look forward to working with you at health fairs.
Thanks, guys.